I'm an assistant director of nursing at Johns Hopkins Hospital, and I'm actually new to that role. I just started that about 2 years ago. Previously, I was a nurse educator for 17 years at Johns Hopkins. And the reason I'm here to talk to you about falls, fall reduction, fall prevention. This is something that I'm very passionate about, and I want to tell you a little story about why I'm so passionate about this. One of my other jobs that I do outside is as a nurse expert reviewer for litigation cases, and I've reviewed about over 100, probably more, like about 150 cases from the Baltimore, Washington, Pennsylvania area related to nurses getting sued. And more than half of those have been fall-related litigations. When I was a nurse on the floor, I would see a patient fall, and I would think, oh, that's really a shame, and it really, hopefully they'll have surgery and they'll get better. But what I didn't realize until I started doing this nurse litigation review is that patients really decline after a fall. And it became obvious to me that a patient who falls in an acute care setting and then gets transferred to a rehab unit has so many sequelae that follows them. They can get an infection. They can get a pressure ulcer. I see some people shaking your heads. This is something that you probably have seen. And then they go on a year and a half later to possibly die. And it was all related to that event. So I realized that at the institution that I work, that we needed to do something about it. And so in 2000, the year 2000, we started a very big initiative on trying to get our policies and procedures related to falls up to speed, where they should be. The other thing that happened concurrent to this was that the Joint Commission came out with an alert. It was Sentinel Event number 14. It was produced in July of 2000, and it talked about falls and the sequela that follows a fall after that happens. If any of you haven't read that, you probably should. It's on the Joint Commission website. And I think that that was the impetus for us starting this big initiative at Hopkins. And we've made a lot of great strides, and this is what the program is about. And we're going to talk a little bit about what we've done at our hospital related to fall prevention. Now, let's see if I know how to do this. Okay. So the objectives of this next hour, and by the way, Pat gave me an hour to speak, so I'm going to rush through it a little bit. This is actually a little bit longer lecture, so I will rush through the slides just a little bit so I can keep you on track. And I do want to tell you that pretty much everything's in your handout, so you will have everything there. I did update it last night. I wanted to put some new information, so a couple of the slides are a little different, and I'll point those out to you so that you'll know where the differences are. This program is about the lessons really that we have learned over the past 4 years since we implemented our fall prevention program at Hopkins, and that's essentially what we're going to be talking about.